Hi, for those that don't know me, my name is Mila, and I'm a Pilates and mobility coach. And my mission is to bring light to a research based exercise approach to improve our bodies, improve our well being, so that we can live life without physical limitations. And today I want to talk to you about a method called ELDOA. It's a method developed by a French osteopath, Dr. Guy Voyer, and it looks to create space in a specific joint. So we have these decompressive, active stretches that improve our posture if we're talking about the spine by decompressing the spine and strengthening the postural muscles. Today, I'm joined by Laura, a fellow Pilates instructor, and she's also an ELDOA trainer. We'll dive a little bit more into her background and training, as well as what ELDOA is, its benefits, and what the future of ELDOA looks like for her and for me, and what we hope to see coming forward in the years to come. So I really hope that you enjoy this conversation. Hi, Laura. I'm so excited to have you here with me today. I want to dive right into getting to know you a little bit. So, can you please just tell us a little bit more about yourself, your experience, and what you do?
First of all, Mila, thank you for your invitation. And about me, I will be super quick because I'm basically an instructor. That's it. I think that I was born for doing that. And I'm a Romanas Pilates instructor. I was so lucky because I'm old, that's the reason, to be trained directly from Romana Krisanowska, that was Joseph Pilates' assistant for her life. So I'm definitely lucky. And that happened 20 years ago. And then 6 years ago, I start to teach. I start my education program in the ELDOA program and Soma training. So 6 years ago, I start to teach also ELDOA and Soma training. That's me.
Oh, that's fantastic. And if you don't mind me asking, what made you choose Pilates and how did you come across the classical Pilates and what got you started with that training?
It's a long story, and because my life it's definitely split in two. So the first part of my life, I studied and I was an artist. Okay, that's why the creativity part in you follow me on Instagram and everything I do it comes from me. So the photo and everything. So creativity is super important for me. And I was an artist. I attended the Institute of Fine Arts and then the Academy of Fine Arts, and I did my exhibition in the time without YouTube, Instagram, in that time. So many years ago. And then I started to practice Pilates as a client. And every time I travel to New York for my job, for art, there were many Pilates studios at that time in New York, but I didn't know what Pilates was. Okay. And then I try. Once I try. And then when I came back to Italy, I discovered that my neighbor was going to open a Pilates studio. A coincidence. It's incredible coincidence. So I start to practice with her Pilates. And at that time, I felt that I was a superstar. I did Pilates like 3 times a week, private lessons. So a great superstar. And one day I went to New York and I said, okay, let's go to Romana Studio. Because I was thinking not to change my life, but to do something different, to do something, when you are an artist, you have a lot of free time. You don't have to go into the office at 9 o'clock. It's something different, right? So I went to Romana Studio and I got some information. And they told me that in Italy at that time, there were just one Romana Pilates studio. Okay. And it was in Rome. And at that time, I lived in Bologna, not in Brescia, like right now. And Bologna and Rome are not so, it's like a couple of hours by train. So I went there. Remember that I felt that I was a superstar in Pilates, right?
Okay.
Remember that because it's important. So I went there and I did my first class, and they kill me, they destroy me. So end of the superstar. So
How? What do
and
you
I
mean?
asked to myself what I was. I mean, this is Pilates. I said what I did until now, and everything started there that day. And then I changed completely my life. Completely.
Okay. And you've done Pilates ever since you've been, I know you have a studio.
Yes. So this happened 2021 years ago. My first session, Pilates session in with Romanos Pilates. And then, yes, I studied I did my 7 hours plus of apprenticeship in Rome. I work in Rome, I work in Bologna, and then I came back here in Brescia, where I was born. So I came back here and I opened my home studio here
Okay.
quite a year
And
ago.
then how did you discover ELDOA and what got you started with ELDOA? Because I really feel like maybe it's just in Switzerland, but it's not very common in
Definitely,
Europe.
definitely.
I discovered it when I was living in Montreal and I was working with osteopaths who were training under Guy Voyer. And my passion for it, or my interest for ELDOA, came because of the osteos that I was working in their studios, and that's how I discovered it. Other than that, I really haven't heard much talk about it, especially when I came back to Switzerland. It's like people don't know what it is.
Yeah, I discovered DOA just because I'm curious. So I was on internet for I don't know why. I don't know why, and then I discovered a video of Guy Voyer teaching something, and not really teaching. Probably he was doing some test. I remember, and then I said, what this guy is doing, first of all, and then the second question was about what he is saying, because you know that Guy has a strong French accent even when he was speaking in English. So that was the reason I was curious, and then I said that this man is a genius, and then I tried to catch some information about him. That's the reason why I discovered ELDOA. And then I did my first certification, the ELDOA 1 and 2. As you know, the education program start with that, with the basic. And it happened here in Italy. And then I start to study with other instructors around the world. And yes,
Okay.
it happened like that.
Okay, fantastic. Yeah. So it's really interesting, because I think social media and just being online can be so negative sometimes, but it's such a interesting place because you really do find useful things and things that spark curiosity in the right direction,
Yeah.
which is cool. And I love social media for that reason. So I guess let's dive into what ELDOA is. And so can you tell me a little bit about ELDOA and what makes ELDOA unique compared to other forms of exercise?
ELDOA is a system of corrective exercises. Okay, so we are talking about corrective exercises. It's not stretching. When someone say it's stretching, I say no, it's not stretching. Boyer always said that it's strengthening exercises, and they regard the tissue. So we work with fascia, and that's the you ask me why it's so extraordinary, this method, why it is so unique, because we work with the fascia in a way that nobody else do. There are many interest in fascia right now, absolutely, but they do the other. They do fascial release, fascial stretching. But you know, Mila, every time we move, we are moving the fascia, we are engaging the fascia, right? Every kind of movement, but we do something really different. So we engage the fascia body in this particularly posture, external rotation of the arm, internal rotation of the lower limbs, we lengthen the full spine, etc., etc., etc. And we do that because that combo of angles between the upper limb, the lower limb, and etc. will target a specific joint. When I say it target, it means that it creates space inside the joint, and that space, of course, we are talking about millimeter, maybe less than 1 millimeter, but you know that millimeter means pain and no pain, the difference. It's a lot. It's a lot. Creating space, it's a lot. It's an incredible method, in my opinion. And why it's so unique? Because compared to Pilates, for example, it's much more specific. So if I have a new client that asks me, that enter in my studio and say, hey, I have an inrated disc at L5S1, I don't know, whatever, I say, okay, I have the exercise for L5S1, or maybe something different at C71. Perfect, we have the exercise. So this incredible specificity, I think that no Pilates, no yoga, nothing can be so specific.
Yeah. You know, I really value that level of specificity. And I think for somebody that maybe doesn't know ELDOA, the question would come, but is it really that specific? And one thing about ELDOA is that you're not guessing, you can feel for it. So as for the ELDOAs of the spine, when I do them with clients, I will actually go and check. So in the training, probably as you did it too, you go and you feel and you know the, best position of the ELDOA once you have that line of tension, that little kind of bumpy feeling that you feel over the vertebra. So when, we talk about how specific it is really that specific. You can
Absolutely.
feel when you've got the T2, T3 or T3, T4 ELDOA. And that to me is, honestly, it's really impressive. It's
Absolutely.
impressive to see how the body has been mapped out to the millimeter, right? So unique in its approach to manipulate tissue or to put tension under tissue and not just say this is what you're getting, actually to be able to feel for it. So many, especially I feel like with ELDOA, T6, T7, T7, T8, those are like the first ones I love to introduce new people to. And they will always be like, oh my gosh, I feel it there.
Yeah.
Because I don't know, in the thoracic spine, the people, I often have people feel it better than the lumbar spine. Just I don't know why that is particularly, but that's the point where people are like, oh my gosh, like I
Yes.
feel right there where you're touching and what we're going for. I feel the, the heat, the tension release, which is
Yeah.
really impressive.
And that's you mentioned the palpation, and that's the one of, I mean, if you are a manual therapist, it's easiest, of course, but if you are not and you're doing the education program, that, in my opinion, is the tough thing to learn, and you have to practice and practice and practice your hands because it's not easy, and that's the reason why, in my opinion, although will never be mainstream, or maybe will be mainstream but not so specific, because we are all different, so you need the hands of your trainer to be specific.
That's true. Yeah. What are some common issues that ELDOA can help with, and why should people try that? I know we touched a little bit about like herniated disc, but can you share more with me?
Yeah, herniated disc, protrusion, so all the spinal pathologies. And you have to know that we have the ELDOA, the ELDOA for the spine, but there are other ELDOA for the spine much more specific. They are called specific ELDOA, for example. And for example, ELDOA for the cranial bones, and ELDOA for the TMJ, and many, 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 many ELDOA for the hip. And to be more specific, not just for the hip in general, I mean the coxofemoral joint, for the SI joint. And not just for the SI joint, but for the greater arm, the base of the greater arm, the base of the lesser arm. I mean, this is incredible. When I say these kind of things in front of an osteopath, they are like this. They don't believe in this specificity. So you can really cure or help, if we don't say cure, many issues. In my studio, I have clients with severe issues. Recently, I'm working right now with a man who had a transplant spinal cord because of cancer. And when he came to my studio, he was so weak, and he has many postural imbalances. And now he is strong, and he's so aware of his body. And it's just 6 months that we are working together, and we are having great results. Or there are another recent case. I'm working with this man like, yes, since one year ago, and he has an hemivertebra in the cervical spine. So that causes a big scoliosis in all the spine, etc. We have to tell to our audience that there aren't only ELDOA for the spine, but also for other peripheral joints. So there are many ELDOA for the shoulder, for other joints, and so you can really help people with many issues, many, many, many issues.
Yeah, it's true. We have to remember that there's different ELDOAs rather than just the spine. I think spine comes up a lot. Personally, I'm trained in ELDOA 1 and 2, and specifically because of how many people are now suffering with back pain. So that's why I kind of always go back to the spine one. But it's true, with the shoulders and the hips, I know with my colleagues that I work with for the SI joint, what they can do. I mean, I haven't seen any other method as effective for pain in the sacroiliac joint,
Exactly.
because and this is something I also like tell my clients, anything that you look at, first you need to create space, then you can mobilize. So if somebody maybe slouched for a long time, before you jam your spine back, you need to just open up. You have to take care of the health of the vertebra, and I really like that. So I think with ELDOA, it's not just for injury, which it is absolutely
Absolutely.
fantastic
Yeah.
for, but for people even without injury, just even like slouching the whole day at your screen, if you could, if people are like, what's the one thing I can do? There's never like one thing, but if there's one thing I could give someone, it's an ELDOA, and it's like
Yeah.
a minute a day to drastically improve your well-being. And it's shocking how effective and underutilized it is. And I really hope that more and more awareness will come towards this fantastic
And
method.
also because it is an osteopathic based technique, you can work also on a different and very interesting level, which is the nervous system. So people super stress, or people who had, for example, concussion or that kind of stuff. So we are working on another level that usually in fitness world you don't treat this
Yeah.
kind of issues. But yes, mentioned the back pain, you mentioned people without injury, but for example it is used also to from professional athletes, for example. And that's an interesting field. They use it to rehab, they use it to prevent injury, to cure injury, I mean recover. That's a super interesting, working with professional athlete with ELDOA.
So with professional athletes, they would use it for post training or in days that they're not playing for recovery.
You can use ELDOA in every phase. I mean, during their training, as a part of their training, and then, or if they get injured, you can use to treat them, and to yes, and in the recovery phase also. Absolutely, you can use it in many moments of their life. Of course, when I say ELDOA, I'm talking about ELDOA, but also the Soma training techniques, not just ELDOA. And I don't know if you want to talk about Soma training also, but we will stay here for like 5 hours.
Yeah. Would you be able to, since it was mentioned, would you be able to give a bit of an overview for anyone listening just to understand what is Soma training and what its link to ELDOA is?
Yes, ELDOA is a part of the Soma training certification or Soma training program, if you want to call it. And because Dr. Voyer invented this series, it's like 14, I think, courses and 14 techniques, but all these techniques involve the fascia. We are talking about strengthening exercises or myofascial stretching exercises or other techniques, for example, the proprioception course, the squat course. But think about all these techniques, Mila, in a fascial perspective, which is unique. And ELDOA is part of the Soma training program. So it's just one piece.
It's like a piece of a bigger puzzle.
Yeah. So when you work with a client, you can absolutely work just using ELDOA, which is so powerful. But if you have all these other tools, boom, it's incredible the result that you can get. Absolutely.
So, yeah. Well, you mentioned that you've been Romana Pilates instructor for 20 years, and now with ELDOA, I believe about 6 years, ELDOA and Soma training.
Yeah.
So, how would you say you've changed or evolved as an instructor over the years?
I completely change for sure as a person, as an instructor, and also my clients, because I have many clients that do both. But I have to tell you something, Mila. There are many instructors that use both the techniques in the same session. I don't do that. I'm not saying that you don't have to do that. That is not good. That is wrong. Absolutely no. Okay. But I don't do that. But remember that I'm training Romanas Pilates. So that's the reason why. So we see the session like a religious session. And in my opinion, it is perfect, the session as we set up it. So I don't feel the necessity to add something different. Also, they are so, the two techniques are so different. So I prefer to, when I teach Pilates, I teach Pilates. When I teach ELDOA, I teach ELDOA. About my clients, many of them do both, okay? But when they are, for example, long-term Pilates clients, and then they start to do ELDOA, they do, follow me, they do it Pilates better because they dramatically increase their awareness. So they understand better, even
That's
if
an
even
interesting,
if they
yeah.
do even if they are long-term Pilates clients. So they know what they are doing, they know the technique. But then they start to do ELDOA and they say, oh, now I better understand what you mean when you tell me blah 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 during that Pilates exercise. If ELDOA, it's about awareness, definitely. If you don't train the awareness of these clients, they are not doing ELDOA. It's not just about, okay, external rotation of the arms, raise your arms, and now you're doing ELDOA. No, it's much more complex.
And especially such a great combination of Pilates, which is also mind-body awareness, and ELDOA with mind-body awareness. So I think together they do complement each other,
Absolutely.
in their different sessions. And I think it's interesting because I can imagine that people who practice both or take both your Pilates and your ELDOA sessions will then see improvements that maybe they didn't notice before, or improvements in segmentation of the spine or articulation of the spine that maybe before was a little bit limited because of that, right, decompressive aspect complementing it now.
Yes, yes. But I think it's something more about, I don't know, their posture, where the spine is, or when in ELDOA can be very tough when you ask to someone, okay, move this, don't move this, move this. I mean, it's not easy. And I repeat, then at that point they do Pilates better
Yeah, that's true. That's really
because
cool.
of ELDOA.
And so, how do you see the future of fitness and physical therapy now that we have this, new approach to the human body?
I think that nothing will be the same, but it will take time. As you said before, here in Europe there is almost nothing about ELDOA. We are trying to do something right now. It's not easy. It's completely different than in the United States because here they want evidence based, and it's different. In the United States, they are more open to this kind of new things. Let's say new things, but there is something that probably we have to say to your audience, that ELDOA is not a new technique. It's something that was born in the 70s. So it's not new, right? And remember what I told you, it will never be mainstream, in my opinion, because you need to have instructor like us, trainers like us, that apply the technique very in the right way, in my opinion. Okay, so yes, yes. But this view that we have of the body, as we said before, there is nothing compared to ELDOA and Soma training, in my opinion. But it will take time. Because when I start to do Pilates here in Italy, there is as I told you, a few just Pilates studio. And when I opened my studio here in Brescia, my studio was the second in Brescia, and that's it. And people, when you say, I'm a Pilates instructor, they say, sorry, I don't know what Pilates is. And now it's the same with ELDOA. So there is a lot to do, a lot to do.
Yeah.
We have to post many reels and many videos and many interviews like this
Yeah.
to share and spread the ELDOA around the world.
I do think it's so valuable. Like I always tell someone, I'm a Pilates instructor because it's the easy way to understand. And, so many people are like, oh, okay, I know what you do. But many clients, I think, come to me because they hear Pilates, but many of them stay because of ELDOA.
Yeah.
And how unique it is with what they can offer to someone. And I wanted to touch base a little bit about, the mainstream or Pilates, with ELDOA becoming mainstream. I think maybe this is something that they're doing intentionally, maybe not. And I guess I hope it is intentional. Is the training that you can do is so specific and you have to go to these locations. It's not as widespread because in order for something to be widespread, it gets watered down.
Yeah.
And we've seen this, with Pilates. You can take Pilates on the weekend, but is it really Pilates? Like, conversation for another time, maybe. But you lose the value of something the moment like the funnel starts to open. And I think ELDOA can be so misunderstood in what it offers. And like when we say just because it's hard, it is super challenging. You're still not pushing someone into pain or getting them uncomfortable. There's, very unique points you have to understand about not hurting someone in these positions, even though they're so safe. But you would lose a lot of value in the method if it gets watered down and becomes, I think, mainstream or available to
Yeah.
the masses. I also think because it's so specific, it's not like Pilates where it has like a flow to it. You really can't start at one ELDOA and do all the way down to all different joints because you will not survive that session. Like they're
Yeah.
super
Yes.
hard. So I think this is where soma training as a whole, and that's why ELDOA is a piece of a puzzle of this soma training course where you can complement it with a lot more like myofascial stretching, etc. So it's definitely interesting to see how it will evolve in the next years. I hope I see more of it in Europe, especially in Switzerland, just because of its benefit on the human body.
Yeah. Yeah, but it will happen. We have to work. We have to work hard. We have to be precise in our message, in my opinion. But yes, it will happen.
Definitely. Laura, thank you so much. I really enjoyed just, touching base about ELDOA with you and kind of opening the door to a little bit of the knowledge that's out there. And I hope that we will continue to do this, maybe give some more sneak peeks into the method and, give people the opportunity to also explore it for themselves.
Yes. Thank you for having me, Mila. It was a pleasure.
Thank you, Laura. Have a great day.
You too.
Bye.